Before you start taking Xeljanz, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. If you are using the liquid form, carefully measure the dose using a special measuring device/spoon. The dosage is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. Take this medication regularly at the same times each day to get the most benefit from it. Remember to tell your doctor if your condition does not get better or if it gets worse. If you experience headaches or diarrhea while taking Xeljanz, be sure to let your doctor or pharmacist know. It's important to note that while this medication may have serious side effects, your doctor has determined that the benefits outweigh the risks. Your doctor will closely monitor you to help reduce these risks. Be sure to contact your doctor immediately if you experience any serious side effects, such as unusual tiredness, rapid heartbeat, or signs of liver disease. While rare, a severe allergic reaction is possible, so seek medical help if you notice symptoms like a rash, swelling, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so if you notice anything unusual, be sure to reach out to your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before starting to take Xeljanz, it's important to talk to your doctor about any allergies you may have and any other medications you are currently taking. It's also important to discuss your medical history, including any history of blood clots, cancer, heart problems, kidney or liver disease, lung disease, infections, smoking, or stomach/intestinal disorders. Xeljanz can increase your risk of getting infections, or make existing infections worse. It's important to avoid contact with anyone who has a contagious infection, and to talk to your doctor if you have been exposed to an infection. It's also important to let your healthcare professional know if you are using Xeljanz before receiving any vaccinations. If you are using the liquid form of Xeljanz, be aware that it may contain sugar, aspartame, or alcohol, so it's important to talk to your doctor if you have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. Xeljanz may increase the risk of infections in older adults, and its use during pregnancy should be discussed with a doctor to weigh the risks and benefits. It is not recommended to breastfeed while using Xeljanz, as it is unknown if the medication passes into breast milk and may pose a risk to the infant. It's important to be aware that Xeljanz may interact with other medications, potentially changing how they work or increasing the risk of serious side effects. This is not a complete list of possible drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, other medications can impact the removal of Xeljanz from your body, which may affect how Xeljanz works. Examples of such medications include rifampin, among others. Be sure to discuss any potential drug interactions with your healthcare provider. If someone has taken too much Xeljanz and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. This can include calling 911 or contacting a poison control center. In the US, you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. It's important to remember not to share Xeljanz with others. While you're taking this medication, your doctor may want to conduct some lab or medical tests to monitor your liver, kidney function, blood count, cholesterol levels, and skin condition. Make sure to keep all of your medical and lab appointments to ensure the effectiveness and safety of your treatment. If you forget to take a dose of Xeljanz, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. Don't take a double dose to make up for the missed one. When storing Xeljanz, make sure to keep it at room temperature away from light and moisture. It's important to store the liquid form in the original bottle with the cap tightly closed, and after each use, place the bottle back into the carton to protect it from light. If you have any remaining liquid medication after 60 days, make sure to discard it. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard Xeljanz when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so responsibly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.